Hey everybody, Craig DeLuz here, once again coming at you live from the Gun Rights Policy Conference 2018. We're here in Chicago, Illinois. Y'all know, I know, it seems like an oxymoron when you start talking about Chicago and gun rights, but there are tons of people here. I mean, the place is packed with people who are interested in learning about about the fight for the Second Amendment that's going on across the country and how they can be more active right here in their own backyard. And with me, I have a good friend of the Firearms Policy Coalition. You guys probably know his organization because I probably talk about his stuff at least once every week, if not once every couple of weeks, and the good information and intel that they put out helping us to understand. And that is Dr. John Edeen with Doctors for Responsible Gun Ownership. Dr. Edeen, how are you doing today?
I'm doing great, Craig. Thanks for having me on.
Fantastic.
I'm looking forward to talking to your audience.
So now, how are you enjoying the conference so far? Anything interesting going on?
No, this is awesome stuff. You know, it's a chance to not only catch up on what's going on in the Second Amendment world, but it's also a chance to network with people that you may or may not know in the industry, or get a chance to make acquaintances and can make connections with people. And that's what it's all about for me, is making connections with people.
Well, and you know, you get a chance to, and this is for the average person who doesn't really get to go, because one of the things you notice is probably about, I'd say, a third to half of the people are people who go to these on a regular basis. And then there's a huge group of people who come from around within like the 200-mile radius.
Right.
And are locals who probably have never had an opportunity to meet people who are on the ground fighting, who know and understand gun policy the way the people here do.
Right. I mean, this is a font of knowledge. The IQ of Second Amendment stuff in that room is off the map.
You know, and it's kind of funny because, you know, being from California, I always say there's probably about 5 people who really understand the intersection between firearm technology and firearm policy. There's a really, really small group of people. By the way, I don't even consider myself one of those 5 as an expert, and I lobby for a living. But what I've come to realize when I come here, I realize and I learn how much I don't know. And it really just kind of inspires me to dig in and learn more, in particular what's going on in other states.
Right, and you know, and it helps you take it to the next level too, because you don't have to invent the wheel. Somebody else may have already thought of the solution to your problem, and so it's the exchange of ideas, it's this exchange of approaches that really makes this meeting what it is.
Now, I do this for a living. I do both Second Amendment media and Second Amendment advocacy for a living. For you, Doctors for Responsible Gun Ownership, this isn't your main gig. What do you do? What do you do when you are not advocating on behalf of the Second Amendment?
Yeah, I'm a pediatric orthopedic surgeon, so I fix kids with broken bones most of the time. We do congenital things as well, and so you know, when children are in need in the San Antonio area of orthopedic stuff, that's when I step in there.
So how did you get involved with Doctors for Responsible Gun Ownership, and why?
Well, how was actually at Gun Rights Policy Conference in 2013. It was in Houston. And Mark Walters invited me to go to the NRA meeting when it was in Houston, and then he prompted me to come to Gun Rights Policy Conference. Mark Walters is the host of Armed American Radio. Anyway, during the course of that meeting, there was a fellow up there. His name is Dr. Timothy Wheeler, and he talked about his organization, Doctors for Responsible Gun Ownership. And I say, I need to belong to that organization, because at the time I was working on trying to get rid of gun-free zones in hospitals, and we were trying to put together a resolution for our county medical society that comes out against gun-free zones. Mm-hmm. And so when I would talk with Tim, he helped me put that together, and so then I was able to present that resolution to our medical society. And I got voted down 22-2.
22-2.
So then I got on the phone with Tim and cried in my milk, and then we got together and we decided we're going to just change tactics and move on. And so, you know, and over time, I've risen to the leadership of the organization. I'm now the membership director, and so I'm out there trying to get folks to join DRGO, and our website is drgo.us, and it's a great resource. There's a lot of information there. We have a blog that comes out twice a week on Tuesdays and Thursdays. There's resource material there. One of the questions that we're always asked is, what do you say when your doctor asks you if you own guns?
What do you say?
Well, there's a lot of things you can say. One is, no, I don't, and lie right to his face and just tell him no. Mm-hmm. If they're insistent, say you wore your NRA hat, to the doctor's appointment, you say, really, this doesn't pertain to what we're here for. We need to move on to a different subject.
I have to be honest. I told my doctor it's none of his damn business.
That's right. That's a nice way of saying it. I mean, I'm trying to be nice. You're being normal, okay? But there's something called a boundary violation, and it's an ethical problem in medicine. It's when a physician uses the physician-patient relationship for purposes other than the medical care. And in the case of this, asking people if they own guns, that's an ethical boundary violation, because they're really pushing a political agenda on you and using the physician-patient relationship to propagate that. And the other thing is that, whether it's deserved or not, physicians are looked up to as authority figures and as supposedly knowledgeable. And I can tell you, most doctors don't know crap about firearms.
It's funny you say that, because like the argument is, well, but they need to talk to them about how to safely store their guns and this, that, and that. And I'm like, what do they know about firearms?
That's right, they don't. They don't get education.
No, let me tell you something. If you're going to tell me that I have to keep my firearm and my ammunition in two different places, you don't know anything about firearms or personal home defense.
That's right.
Period.
And here's another interesting thing: is there was you know who David Codria is? He's in Ohio.
Okay.
David Codria came up with a form with a now deceased sheriff sheriff's deputy in California that basically says, I want it's something you have your doctor sign. He says, I'm giving you advice about firearms, even though I know absolutely nothing about it, and I assume all liability.
Right. Exactly.
And the other thing is, you can always ask them, does your insurance company know that you're practicing outside of your scope of medical practice? And if I'm harmed by the advice that you give me and I sue you, is your insurance company going to cover you? And all of a sudden, the little lights go on in the eyes of the doctor, and they'll move on to a different subject. So there are various strategies you can use. That. But the bottom line is, they're in waters that they don't belong in, and they really don't have any idea what they're talking about. The problem is organized medicine now is predominantly anti-Second Amendment. You look at the American Medical Association and the American Academy of Pediatrics, even to some extent the American College of Surgeons. They've been co-opted by the academia, who tends to lean to the progressive side. And so, we have to be very careful about accepting a lot of stuff that comes out in the mainstream medical journals. A lot of the stuff is very biased, and that's one of the things that DRGO does, is that we look at that type of thing, we analyze it, and then we critique it, and then we put it out. And so if they come up with some study that's totally biased and it's obvious that it's full of what, we say this is full of what, and here's why.
Well, and that's the thing, because I always say is, in particular, what you notice, a lot of these people seem to do these research studies on firearms or gun violence or violence with people used by firearms, is first of all, they're generally from the medical profession, and I'm thinking to myself, sometimes they're epidemiologists, but I'm thinking, wouldn't it make more sense to have a criminologist?
I absolutely agree with you. One of the things that we say is that guns are not a public health issue.
No, they're not.
So, but things like mental health availability, that's a public health issue.
Right.
like family, the breakdown of the family. That's a sociology issue. It's a multi-specialty area, but the criminologists and the economists and those are the people that study this stuff, and they probably have a better handle on it than the medical side.
Well, but the medical side tends to come at it from the perspective of this is a disease. Owning guns is a disease that needs to be cured. Well, and for them, the simplest cure is get rid of guns.
Right. But the problem is their premise is wrong to start with.
Exactly.
That the gun is the problem.
Right.
And it's not the gun is not the problem. It's the criminal. It's the violent person. It's the psychopath. It's the sociopath who the person who wants to do harm to others. That's the problem, not the tool that he uses. Because you could be just as dead if the guy stabs you rather than if he shoots you. So it's not the tool. It's actually the person. And so and that's a much harder thing to deal with. It's much easier to blame the gun. Right. The gun's easy because it can't argue back, right, and it can't fight back. And it can't call its elected representative and complain about you, and get your funding taken away or whatever. So that's really the big issue here. They look at it from their premise is wrong to start with. So you're going to come up with garbage. And the other thing is they tend to use a lot of selection bias. They tend to select years and groups that will give them the answer they want.
Well, I always find one of the interesting ones is when they start talking about industrialized nations.
Right.
In other words, they want to get rid of nations that whose numbers who have gun control, but have much higher firearms murder rates, like Brazil, which had 60,000 last year.
Right, and that's selection bias. Right. You exclude the data that doesn't help you, make your case. In fact, it will damage your case. It'll flip it upside down, and that's why we value Dr. John Lott so much, because he's the guy that sifts through all this stuff, and he's a phenomenal resource for all of us. And if you're not familiar with Dr. John Lott, you need to get.
If you are not familiar with Dr. John Lott, then you are not knowledgeable in just the whole battle, the communication, the data that is at the center of the fight for our right to keep and bear arms.
Right, and he can be found at Crime Prevention Research Center.
Yeah.
And believe me, the guy is a gold mine of information. And the thing is, they try to go after him personally because they cannot refute his studies. Right. His studies are done so well, and we're fortunate that he comes to this meeting all the time, and we always get some new gems. Mm-hmm. But everything he puts out is worth its weight in gold.
Right. Now, getting back to, so earlier you were talking about like doctors who ask you about guns or anti-gun doctors. Now, obviously, like you said, the AMA seems to be heading a direction that a lot of us aren't comfortable with. So, what if our doctor is in that position? What if we want to find a doctor who's more comfortable with our right to keep and bear arms, one that we know is not going to meddle where he ain't supposed to be meddling? What options do we have?
Well, strange that you may ask that. Doctors for Responsible Gun Ownership about a year ago started a project, and it's called 2adoc.com. And what it does, it sets up two databases. One, a database of patients looking for a certain type of 2A friendly doctor, and another group of doctors who are 2A friendly and who will not ask you questions that violate your civil rights. Mm-hmm. The biggest problem that we're having right now is actually getting enough doctors, especially primary care doctors. It's like 3 to 1 of requests to physicians. And it's a free service, so it doesn't cost you or the doctor anything, and it's a secure database, and it's not open. It's not an open database. Even the people who make requests can't search it. What we do is we match the doctor to the patient, and then we send you an email. And so, because we don't want Bloomberg's minions picketing outside of the offices of 2A friendly doctors.
Right.
And so, what we want to do is protect everybody's confidentiality, and I think that's very important. But it's something that we're working on getting off the ground. Unfortunately, right now, there's going to be times when we don't have anybody available for what you're looking for. If you're looking for an optometrist or pediatrician or a family practice doctor or an internist, or you think of it, whatever specialty. Now, if you're looking for a pediatric orthopedic surgeon in San Antonio, I know exactly who you can look for. And my other partner, one of my partners, is also a very 2A guy. And so if you want to talk 2A stuff, come to us. We'll be happy to take care of you. But that's the kind of thing that we're looking for people. We're trying to match people with providers that are 2A friendly.
Excellent.
And that way you don't have to worry about the nonsense of organized medicine.
All right, so how do folks find Doctors for Responsible Gun Ownership?
You can find us at drgo.us. That's our main website, and there's actually a link to 2adoc.com there as well. We're on Facebook and Twitter and all the other stuff. Our Facebook page is kind of interesting because we get a lot. We make posts every day on Facebook, and then our blog posts come out on Tuesday and Thursday, and those go up on Facebook as well. So that's not a bad place to look for, see what we do.
That's a great page. You ought to like it. Make sure you sign up. Click on the notifications. Make sure, so that way you get notified every single time they put a post up or something like that.
And the drgo.us website has got a lot of information. We put out a white paper about the Hearing Protection Act and how suppressors protect your hearing and why they're the best choice. And it's a bunch of ear, nose, and throat doctors that wrote it. 2 neuro-otologists, the guys that deal with sensory neural hearing loss, and two normal surgeons, including Dr. Wheeler, who's an ear, nose, and throat doctor. And we've also done a white paper about these extreme risk protection orders, the red flag laws, and why they're unconstitutional. And I actually used this past summer in Texas. We actually gave that to all the representatives and the senators that were on the hearing committees for the red flag law that the governor of Texas wanted to put forth, and there was such an outcry that he just dumped the whole thing.
There you go.
And so you can be effective,
right?
And I have to thank Alice Tripp, who was the Texas State Rifle Association lobbyist, because she called me and says, "Hey, what can you guys do to help us?" And so we're a resource, and if you're in another state and you need a resource about medical things, contact us at drgo.us. We are a resource for you. We have experts in all different fields.
It's funny you say that, because we did actually have someone from, they weren't from Doctors for Responsible Government, but they were actually from the National Suppressor Association. But once again, it was a medical doctor. He may be a member of Doctors for Responsible Government, but the ability to have an expert there, to have somebody who can refute, because they generally don't have experts, and they completely will ignore data, but it's very difficult for them to disagree with someone who comes forth, who's knowledgeable, who is from that subject area. I'm a lobbyist, and I may know the law and the policy, but to be able to bring someone, in particular in some of these cases, who can bring and talk about some of the real medical issues who's there on the ground, it is invaluable in terms of advocacy.
Yeah, that hearing paper has photo micrographs of the ear, the little hair cells in the inner ear that are normal, and then ones after hearing loss from noise. And they talk about the decibel ratings and all this kind of stuff. How much noise is a jackhammer and a 9mm pistol and a rifle and all this kind of stuff. And it talks about how much exposure you can have until you have hearing loss, and all that kind of stuff. And so there's a lot of information there that's really good to know. And I passed all that stuff on to my U.S. Representatives when that stuff was going up in front of the House, and also to both of my senators. And so you can take this information and pass it on to your representatives and say, look, this is the truth. This is the data. This is medical information. These guys are experts in the field. You need to be aware of this. So you can help educate your representatives so they can represent you.
Exactly. Everybody, once again, Dr. John Edeen with Doctors for Responsible Gun Ownership. We very much appreciate you coming on the show. I look forward to having you on in the future. If I come across any studies on the website, that I would love to have you either come on, promote, or clarify. Would look forward to having you.
I'll be happy to do so.
Excellent. Thank you, sir. All right, folks, well, that's going to be it for this interview. Obviously, we've got a lot more going on, so please remember, like and share these videos. Tell everyone about the Gun Rights Policy Conference, because it's going to be coming to a town near you, hopefully sometime in the near future, hopefully sometime in the future. But also, remember to tell them about the Firearms Policy Coalition. We are the home in the fight for civil rights. Got to use them, or you're going to lose them. You guys take care.
If you like our videos, follow, subscribe, like, and share.